Well, breaking right now, Alabama Governor Kay Ivey announcing the state's COVID public health authority is going to end on Memorial Day. So that's Monday, May 31st. But the state's emergency is ending Tuesday, July 6th.
This comes as the U.S. is making promising headway in its battle against COVID. But some health experts believe herd immunity could be unlikely.
Isabel Rosales is breaking down the reason the experts say life could still return to normal even without herd immunity.
COVID-19 deaths are on a decline in the U.S.
That's the reason why you hear all of us in the public health sector essentially pleading with people to get vaccinated so we could crush this outbreak.
More than half of U.S. adults now have at least one dose of a COVID-19 vaccine. But some health experts say because of variants and vaccine hesitancy, they're unsure herd immunity will ever happen.
If we can get the infections under at very low levels, most of us can get back to our lives in normal ways. I think we can probably live with that.
By the week, more signs of returning to a pre-pandemic normal. Cruise ships back at the port of Galveston.
Oh, I'm very excited. I love cruising.
States are loosening restrictions. New York's 24/7 subway service making a return later this month. And most capacity restrictions for retail, museums, Broadway and more slated to end this month. But the crisis is worsening in other parts of the world.
More cases of COVID-19 have been reported globally in the past 2 weeks than during the first 6 months of the pandemic.
India is now right behind the U.S. and Brazil in total reported deaths. Meanwhile, Moderna just announcing it will supply up to 500 million vaccine doses at its lowest tiered price to low and middle income countries. In Washington, Isabel Rosales, Fox 10 News.
Mobile County is considered very high risk for COVID-19 transmission. That's according to the State Department of Public Health. But the daily case count is dramatically lower than it's been for most of the pandemic. So what's going on here? One health department doctor says he's not sure if the recent uptick is due to relaxation on the mask mandate, spring break, or it's just a blip.